Dr. Weisman, thank you very much for being here today. We're at the Center for Device Innovation at Texas Medical Center, and I really appreciate your time. Will you please introduce yourself and your role at Vax-Immune?
My name is Leonard Weisman. People call me Lenny. I'm the co-founder, president, and chief technology officer at Vax-Immune.
Fantastic, thank you. So before we get into Vax-Immune, I want to talk about you a little bit. Mm-hmm. So did you have a passion for technology at an early age, or was there a specific event in your life that led you to medical devices?
Well, I've actually been involved in several product developments from an entrepreneurial perspective. I made the original observation for a product called Respigam and Strategist, which was the first products by a company called MedImmune. And as you know, they sold for $16-17 billion about 10 years ago.
So did that stem back from anything that you experienced as a child? Did you have inspiration from somebody in your family, or did you always know that you wanted to be in this space?
Well, I knew I always wanted to be, as a child, I always knew I wanted to be a physician. And then actually went to West Point. After being in the Army for a year, I was fortunate enough to be able to go to medical school. And then after medical school, I was actually in the Army for about 24 years. Then came to Baylor, where in the Army, I was actually a physician in the Army, just to be clear. And when I came, then I got recruited to come back to Baylor, where I actually went to medical school. And I've been here now for 25 years. So that's kind of my background.
Thank you for your service, first and foremost. So now let's dig into Vax-Immune specifically. What's the story behind the story? What's the story of Vax-Immune?
Well, Vax-Immune, just like the first two endeavors, Vax-Immune was an attempt to develop a product to prevent an infection that was causing problems in pregnant women and in babies. Specifically, there's a bug called ureaplasma, and that's been associated with preterm birth and in chronic lung disease and other diseases in preterm babies. So given my experience with developing other vaccines and antibodies, we said, let's go out and develop a vaccine and an antibody for this particular bug. And we actually did. We have a vaccine, we have a therapeutic antibody and diagnostic antibody. We did that while I was at Baylor, and Baylor submitted a patent, and those patents have actually been approved. But the problem was to take a vaccine or an antibody to market is probably anywhere from a 15 to 20 year commitment, and $1 billion or more. And so I talked with a lot of people who I knew at some of the pharmaceutical companies, and they said, you should pursue a diagnostic. That's something you can do in 5 years, maybe 7 years. It costs less money to develop. It costs about $15 million instead of $1 billion. So that's what we went ahead and did. We made a diagnostic for this particular bug using the antibody we had developed. And as it turns out, the diagnostic worked, but it needed a lot more bugs at the end of the diagnostic to make it work. And we decided, well, how are we going to do that? And so we came up with the idea for LabReady, which kind of delved into another area that we were interested in, was being able to accurately diagnose infections.
Makes perfect sense. You just led me to my next question. Can you tell me a little bit about LabReady?
Well, LabReady is a handheld, portable, disposable device that collects, processes, transports, prepares the sample, diagnoses it, and reports the infection to the either the consumer or to the physician. Our first generation device does everything except the direct reporting. Our second generation device will actually include the ability through Bluetooth to be able to report to the patient or to the physician the result of the test.
So there is a digital health component
Yes.
to LabReady.
Yeah.
How has the evolution into digital health been for you? Because it is fairly new.
It is. We've struggled with initially trying to figure out what the best mechanism was, whether it should be Bluetooth or cellular, or whether it should be Wi-Fi. Wi-Fi isn't always available or reliable. Bluetooth, almost everybody does have a cell phone.
Understood. Thank you. So I want to talk a little bit about where we are right now. So we're at the Center for Device Innovation at Texas Medical Center. And as I understand it, you're part of the J-Labs at TMC Group. How did it feel to be chosen to be among this group?
It felt great. We were honored to be chosen. They've been very generous in their assistance, educational, advisory. They connect you with strategics, with advisors, with consultants, with investors, with manufacturers. It's a fairly, with regulatory people, clinical research. So the list is fairly extensive. We've actually come over here to the CDI. The engineers have helped us. We had a couple of questions on our device, and they were, again, very helpful and provided the services and really did a great job.
I love that you're using other resources from the campus. That's fantastic. That you're not just with the J-Labs group, but you're able to lean on the CDI side and really take advantage of all of the resources at TMC. What was the most recent milestone that Vax-Immune achieved?
Well, most recently we received one of our 2 patents were approved by the U.S. Patent and Trademark Office. And we've basically completed 3 manufacturing runs. So we have our device ready for FDA testing, and we have our clinical sites and our clinical protocol developed. And so we're about ready to embark on our FDA-associated clinical study.
So now it's even ramping up more.
Yeah.
If you can imagine.
It is, it is.
Well, good luck.
Thank you.
Very exciting.
Thank you.
What's your next milestone?
Our next milestone is to get FDA approval probably this time next year, and to hopefully by the end of next year start sales. That's for our first generation device. Our second generation device, the home testing device, will be more of a 2-year addition to that, so probably about 3 years from now.
So you have an idea, you see it come to fruition, now it's to market, now you have to start selling it. Are any of those aspects, would you say, more complicated or have been surprisingly difficult?
Yeah, the design part was pretty much what I expected. Transferring the design to manufacturing was actually more complicated than I thought. That was fairly complicated. FDA testing and approval, I've been through that before, so that I think is pretty much what we have expected. The sales piece is actually very complicated because there's more components to that than anyone really anticipates.
Well, I wish you the very best of luck. Before I let you go, Lenny, do you have any closing remarks or anything that you want to share?
Well, just to reiterate, LabReady is initially going to be a device that will collect, transport, prepare the sample for the laboratory so that when it gets there, they can make the diagnosis in just a few minutes. But our second-gen device is the one that we think will be the most exciting, and that will allow the patient to stay at home, diagnose and treat their infection. That, to me, is just the ultimate. You don't have to get up if you're sick and go into the doctor's office. You can do it really basically from your home.
I will be honest with you, I cannot even visualize what that would look like. I wish you the best. I can't wait to see all of your future successes, and I'll be keeping a close eye on you.
Well, thank you. Thank you very much.
Thank you very much for being here, Lenny.
Thank you.
Thank you.